An emergency room visit abroad is stressful enough. The last thing you want is a claims nightmare afterward. In this walkthrough, I'll show you exactly what to do from the minute you arrive at the ER to the moment your reimbursement lands in your account, including what to say at check-in, how to handle direct billing versus pay and claim, which documents to collect, the way to submit them, and what to do if your claim is delayed or denied. I'll speak to retirees in plain language, but the steps apply to anyone living or traveling abroad. If you want a simple one-page claims checklist and a plug-and-play claim tracker sheet, check the links in the description. I've put helpful resources there, and if you're serious about retiring abroad with confidence, subscribe for more practical step-by-step guides like this. Pre-ER. Setup you do once, so claims are easy later. Before an emergency ever happens, set the table for a clean claim. Take 15 minutes today to do this. Create a care packet. Front page, your legal name, date of birth, passport number, local phone, emergency contact, insurer name, policy number, and 24/7 claims hotline. Second page, your top diagnoses, medications and allergies in plain text. Install your insurer app portal and verify login with a reliable number eSIM so two-factor codes work abroad. Take a screenshot of your digital card. Find your nearest preferred hospitals, private where possible, and note whether they have direct billing with your insurer. Save their ER addresses in maps. Download blank claim forms and save them to a medical folder in your phone cloud. Decide your payment plan. If direct billing isn't available, you'll pay and claim later, so keep a funding source ready: credit card, emergency cash, or access to a transfer. No pre-authorization rules. Many policies require notification within 24 to 72 hours of an admission. Store the hotline number and policy PDF for quick reference. This tiny setup removes 80% of claim friction later. Arrival at the ER. Words that unlock the right process. When you arrive, triage first. For chest pain, stroke signs, heavy bleeding, get seen immediately. As soon as a registrar is available, say,
I have international private medical insurance. Do you have direct billing with my insurer? I can provide the policy card and authorization call if needed.
If direct billing is available, the hospital may contact the insurer for guarantee of payment, GOP. You'll still sign forms and might leave a small deposit, but the provider bills insurer for covered services. If no direct billing, tell the registrar you'll self-pay and will need itemized invoices and a detailed medical report for reimbursement. Use your funding source and keep every receipt. Get a case number. Ask for a hospital case, chalked record number, and the physician's name. You'll need them on forms. Notify your insurer, or ask a family member to, as soon as you know it's more than a quick visit, especially if admission, surgery, or evacuation is possible. Note time, date of the call, and the agent's name. Tip: be polite but specific. The words itemized invoice, medical report, direct billing, and authorization are the magic keys in most systems. During treatment, keep a paper trail without being a nuisance. Your priority is care, but a few small habits protect your claim. Photograph wristbands, admission stickers, and room labels once you're settled. They're useful if paperwork goes missing. If a scan, procedure, or transfer is proposed, ask, will this require pre-authorization? If yes, request the nurse's station to call your insurer while you're present, or call yourself on speakerphone. Medications. Request generic equivalents where appropriate, often cheaper, sometimes required by policy language. In self-pay situations, ask for estimates before non-urgent procedures and confirm you'll receive itemized billing afterward. Keep receipts daily. Photograph them the same day into a medical year-month album. Paper fades, photos don't. If you're moved to a different unit or facility, note time, reason, and ambulance details. Transfers matter for coverage and evacuation benefits. Discharge paperwork, the exact bundle you must leave with. Do not leave the hospital without these 4 items. If direct billing was used, you might still need them for your records. If you self-paid, they're essential. 1. Itemized invoice with dates, patient name, facility info, and a line for each service, e.g., ER fee, labs, imaging, drugs. 2. Medical report discharge summary, diagnosis, symptoms, exam findings, physician notes, treatment provided, and dates, times. Ask that the diagnosis codes, ICD-1011 and procedure codes or local equivalents appear when possible. 3. Proof of payment, card slips, cash receipts, bank transfer advice, matching the invoice total. 4. Prescriptions and test results, lab reports, imaging summaries, and any doctor's orders for follow-up. Bonus: if the event involved injury, assault, or traffic accidents, request a police report number or incident record. Some policies require it for claims related to accidents. Submitting your claim, how to fill forms and get paid faster. Set aside 20 to 30 minutes to submit the claim cleanly the first time. Open the insurer portal or app and start a new claim. Choose emergency, inpatient, or outpatient as applicable. Claim form basics. Names and dates must match passports and hospital documents. Use the hospital case number consistently. Diagnosis and cause. Keep it factual. Acute appendicitis, fall at home, etc. If an accident, include date, time, location, and police report if available. Upload documents in this order. Itemized invoice, medical report discharge summary, proof of payment, prescriptions and results, then your passport ID page, if requested. Currency and bank details. State what currency you paid in, upload the card or bank statement showing the charge, and provide IBAN SWIFT for reimbursement. Deadlines. Many policies want claims within 90 days of treatment. Submit early, then add addenda if needed. Keep a log, date submitted, claim number, documents included, and who you spoke to. If you don't have an insurer yet, or you're considering switching to one with streamlined claims and clear direct billing networks, start with the vetted comparison options in the description links. You can filter for plans that match your age band, visa requirements, and claims preferences. Avoid delays and denials, the 7 most common pitfalls. Most slowdowns boil down to missing details. Avoid these. 1. No itemization. A single medical services line is unpayable. Ask the provider to break it down. 2. Mismatched names, dates. Ensure every document spells your name and shows dates consistently. 3. No medical report. Invoice only isn't enough. Insurers need the clinical story. 4. Pre-auth gaps. If your policy requires notification for admissions or imaging, explain in writing why it wasn't feasible and submit call logs afterward. 5. Policy exclusions. Read the pre-existing condition and waiting period clauses. If the ER event is unrelated, say so clearly and include a physician note. 6. Duplicate submissions. Upload clean, single PDFs instead of 20 photos across multiple uploads. 7. Wrong benefit bucket. Use the correct claim type, ER versus routine outpatient. Mislabeling can send it to the wrong team. If you receive a request for information, RFI, respond within 48 to 72 hours with exactly what they asked for, no more, no less, and note it in your log. Tracking, EOBs, and appeals. What happens after you click Submit? After submission, you'll usually see one of 3 outcomes. Paid in full to you, for self-pay, or to the provider, for direct billing. Partially paid with explanation of benefits, EOB, showing deductibles, co-pays, policy limits, or non-covered charges. Pended denied pending more info or citing policy terms. What to do? Read the EOB line by line. Confirm dates, codes, amounts. If a charge is not medically necessary or not covered, ask for the policy clause they used. Balance bills. Provider comes after you. If direct billing was used, share the EOB and ask the hospital billing office to reroute to the insurer. Don't ignore letters. Appeal basics. Write a short factual letter referencing your claim number, attach new evidence, doctor letter clarifying diagnosis, updated itemized bill, and point to the relevant policy section. Keep it under 1 page plus attachments. Watch timelines. Many policies set 30 to 60 days for appeal windows. Mark the calendar and follow up weekly through the portal or phone. Currency questions. If reimbursement arrives in a different currency than expected, ask for the FX rate and date they used. Some insurers reimburse in billing currency or policy currency. Keep every message inside the insurer portal when possible. In-system messages are time-stamped and easy for claim teams to review. Special situations, evacuations, multi-policies, public systems. Medical evacuation or repatriation. These almost always require prior authorization unless it's a life-threatening emergency. Call the assistance line early. They coordinate aircraft, receiving hospitals, and customs letters. Keep flight logs, invoices, and medical necessity letters. 2 policies or Medicare plus private. Disclose coordination of benefits. The primary policy pays first. Submit the EOB from the primary to the secondary. Do not double bill. Public plus private blend, for example Portugal SNS or Mexico IMSS with private. You may need to show that private benefits apply only to private facility charges. Keep separate paperwork if you use both systems. Prescription-only events. For ER discharge meds, submit prescription plus pharmacy invoice plus proof of payment. Some policies cover only drugs tied to the ER visit, include the doctor's note. Fraud flags. Round numbers, missing dates, or identical charges across days trigger reviews. Stick to scanned originals and keep explanations factual. Don't wait for a crisis. Take 10 minutes to download the claims checklist and claim tracker from the description, and, If your current policy's claims process feels clunky, use the vetted comparison options there to price a plan with simpler direct billing and clearer reimbursement rules. It's the cheapest way to buy peace of mind. Your 2 next steps. First, save this video and share it with the person who would help you during an emergency. Second, set up your care packet and download the claims checklist and claim tracker from the links in the description. The moment something happens, you'll know exactly what to say and exactly what to keep, so your claim gets approved and paid. If this helps, subscribe and turn on notifications. Next up in the series, Nomad Insurance versus Expat Plans, what's actually covered, and healthcare abroad, the best and cheapest options for retirees. I'll see you there.